community is a very tedious and expensive process, extremely expensive. So to ensure that you achieve your goals when you're developing, then you have to ensure that what you're going to do is going to do what exactly you want it to do. And this process, there are some critical steps you have to take. And yeah, we develop for the last mile area. So I believe what we do ensures inclusivity of all the different populations. And so this could actually be like a blueprint on how to develop inclusive technologies for last mile areas. Yeah. So first thing that you have to do before you develop anything, I understand you've acquired a skill, you can develop, you know JavaScript, you know the different software languages, but what are you developing for? Who are you developing this for? Which gap are you filling in the healthcare service provision space? And so you have to identify this gap and isolate it out of the clutter and ensure that after isolating that, you ensure that it aligns with broader strategies. For instance, we have the national development goals, we have the digital health strategy, we have all these other different strategies. So you have to ensure that it aligns well with all that. First, it's strategic that you're going to need a lot of resources when you're developing these apps. You know, you're going to need to identify partners in that same space. So if you develop your app or if you align to broader strategies, that means you're going to have a community that is going to support you when through this journey of developing an app. So after you've identified the goal, rather the gap in the space that you're developing for, then you're going to have to map out the partners. You're going to need partners. You can't walk this journey alone. So among these partners, you're going to need the regulators. So you have to identify how many regulators are going to be responsible for overseeing the app that you're going to develop. If you're going to provide services of pharmaceuticals, then chances are high you're going to need you're going to look at the National Drug Policy and Authority Act and see how that applies to what you're developing. If you're developing for the community health workers, then you're going to have to consult with the Ministry of Health on how you're going to do that together, or whether actually there are other tools that have been developed that are doing exactly what you want to do. So you may be here wasting a lot of resources, and yet what you're doing is already being implemented somewhere. There is already someone who has achieved traction with a solution that is the exact replica of what you're trying to develop. Yeah, so then after that, very important, after you have identified that there is need to develop what you're going to develop, you've identified the partners, then you need to look at the population that you're developing for. This is where the inclusivity comes in. So you're developing, let's say for the last mile areas, and you know you're going to target community health workers, then you're going to ascertain their digital literacy. You're going to know at what level are they and which features are compatible for their use. So this is why you're going to find that some features may not really be applicable, not that they're not really important, but for the population that you're developing for, they'll never use them. So you're going to have to scale down or scale up a little bit depending on the digital literacy results that you get from the communities. And then also you have to assess the digital readiness. Some people may not be ready. You may be developing, you're not going to offer smartphones, but then the people you're developing for, they all have a phone like this one. And then you're developing apps that are only supported by a smartphone. So that means what you're doing is futile. You're not going to have anyone use your product because the people are not ready for your product. So after you identify the gap, you assess your population, you've preempted all the regulatory requirements, and you've planned on how to go about them, then you can actually go ahead and develop. And after you develop, you keep getting this user feedback from the people that are using the different tools that you could have developed. So you have to incorporate research and I think we can agree that this is all like some sort of what I'm describing here is literally research. So you have to keep getting these user feedback to know which one, what is working, which feature is achieving the intended aim and which one is not. What do you have to remove? What do you have to include? Is the tool you've developed achieving its purpose in the community? You have to do impact assessment. You have to have a plan to do impact assessment for that whichever tool. A group may come up to start developing apps. They're going to have guidelines readily available for them. We weren't so lucky. But at least right now the regulators are catching up, and we are also contributing to these discussions and through these spaces, and we are showing those that are coming up how the system should be, where it should start from, what has to be regulated, where the focus area should be in terms of regulation. So those that are developing currently, I think there is no excuse to say that, hey, I don't know who is going to regulate me. I don't know how to incorporate regulations. The regulations are actually there, and they guide very much. The guidelines are there, so you can follow those through, and then you can know which skill set you need in the human resource you're going to have. For instance, the data protection office will tell you that you need a data protection personnel who has this particular qualification. So you know from the beginning that I'll need to hire this particular person. They're going to tell you that you're going to need this level of security for your data. Then you know you're going to budget for what you need to buy or what you need to purchase to have that level of security for your data. You may have partners, as I think most people do, partners outside the country. So they are going to require that the data sharing agreements you have with those partners explicitly show that the partners, the jurisdictions where your partners are located have laws that are at least similar to the laws that we have in Uganda in regards to data protection. So after you have to preempting before you actually go ahead to develop a system that will ensure inclusivity and privacy of personal data. Thank you.
Thank you so much, Dr. Miro. The key point I take from your submission is preparedness and impact assessment, and also understanding the end user before trying to come up with a solution, but also the main thing is the gap. Now, driving on that, the gap, I want to come to the mental health specialist here in the room. So many digital health tools have come up. We have so many in Uganda, several. In fact, AHAKI has, in collaboration with the University of Warwick and some of the people here in the room, we have mapped the digital health tools, the apps that are being used in the country, and we intend to bring out our findings during the month of January next year. But we realize that we have almost 100 apps in the country. So I want to now to ask you, Mr. Onyaiti, do you think the landscape in Uganda is considerate of the mental health implications of digital health? Because as you know, you and I, digital health has both, it can have both good and bad implications on people's access to health. So what do you think is the landscape in Uganda in terms of the intersectionality between mental health and digital health inclusivity in the country, and what can be done? Please limit the discussion within 5 minutes. Thank you.
Thank you for that question. I'm wondering where to begin from, because it's quite wide, but this is my understanding of the mental health landscape in Uganda. And the good thing is that when you talk about the mental health landscape in Uganda, you're literally looking at Africa. So Uganda can be a case study of what we are looking at. We need to understand that health, the aspect of health, has not yet been fully appreciated in Africa. That someone will first fall sick before they go to hospital. We have not yet understood that health is that important that we need to go to hospital regularly to check a few things here and there. If I would maybe take a sample here, I would wonder when was the last time each one of us went for a dental checkup. Now, when it gets to mental health, the situation is worse. So if people cannot look after their physical health, what about their mental health? Now, there are strides that are being made, developments are coming in, different apps are being developed, awareness is being spread in regards to health. That is why today we are talking about digital health. But there are aspects of health that are being neglected, like mental health, because few people understand that mental health, for example, is part of the physical health. They do not know that there is a thin intersection between the two, that your mental health affects your physical health, that your physical health affects your mental health. I'll give an example of a cancer patient. They've told you you have 4 months to live. Do you think your mental health will remain the same? So if strides are being made towards general health, do we have strides, do we have developments in regards to the mental health sector? Then I would say, my answer would be a yes. Is it appropriate? Is it sufficient? No. However, I do not want to dwell so much on what is not happening, right? But I want to say that there are avenues that we can use, such platforms, the organizations out there that are pushing for mental health specifically, because once people understand that mental health is important, once the awareness is spread, then developers, the government, the legislators out there are going to be able to get policies that are going to push for health, not only health as a general or as a general aspect, but mental health. For example, you look at the recent Mental Health Act. It's one of the most advanced legislation we have in Africa when it comes to mental health. Things that consent are included. Things like accessibility, things like affordability, things like, have I talked about consent? Yeah, things like consent, inclusivity, whether you fall under the LGBTQ community or not, the Mental Health Act protects you. Because for us, when it comes to mental health and when it comes, for example, in MindWatch Foundation, when you come to us and you need to talk to a therapist or something, we do not look at you and wonder, are you under the LGBTQ community? No, we look at you as a human being who has come to us. Are you a human being or not? Because we are looking at human beings, so the rest does not matter to us. We do not care whether you are someone with a disability or not. We work on you because you are human, and mental health is for everyone. Maybe that is something we need to look at even when we're looking at general health. For the developers out there are things like sexuality that should not matter. I remember Solomon was saying that people do not, he hasn't seen that Ugandans have that, I don't know how to call it, they can gauge. They can easily tell that this person falls under the LGBTI community or not. However, if we use digital platforms, that can take away what should I call it, whereby you just have to look at someone and judge them. But with online or digital e-services, we can get to a point where someone can be anonymous and talk to a therapist and help them without the therapist knowing that this person falls under this particular, light under the spectrum or what. So digital platforms can be a source of help in regards and help us to eradicate issues like discrimination. Thank you.
Thank you so much, my wonderful panelists, for giving us great insights. Thank you so much. I think I would now not dismiss you, but I would let you go back to your seats. Thank you so much. As we get prepared for the second session, Afya na Haki has participated in the promulgation of the Kenyan Digital Health Act, and we've been invited in different spaces in Kenya to contribute to their advanced digital health landscape. So, and we've realized that most of the things that have really catalyzed their move to where they are now, the PPEs, but also the multi-stakeholder collaborative efforts, because as some of you know, things like the Digital Health Act of Kenya were it was promulgated within a few months, 2 months, it was already an act of law. And so we know
It's like the digital health.
So I know for sure that there is power in working together. And so now I would like to get back the microphone to the main moderator to take us into the session on a consensus document, something that will communicate the things that we've deliberated on today. But I also know that Alima is thinking about a research, a qualitative research paper, which we'll put out there for our academicians and students to learn more, so that we don't waste the knowledge that we've gathered today. Thank you so much.
Thank you very much, Frank, and thank you for our last panelists. We apologize for reaching up to this time, but we are coming to the very end, and that is getting a qualitative paper. And it's good Lenny has come. She is the one that is supposed to be taking us through this session. So I will just give quick insights, and then she will come and take it up from me. So we are going to have a qualitative paper from all the discussions that we have had, and we hope that we have your consent so that when you see a paper come out and has some of the quotes that you have mentioned, you don't feel that you have been ambushed. Then the other thing is that we are looking at forming like a forum. We have been able to get your phone numbers. Would like to also request that if you are able to permit us to form an interactive group where we can be advancing digital health inclusion. So we hope that you will allow us to be able to put you in our WhatsApp group, which we shall call the Forum for Advancing Digital Health Inclusion in Uganda. And whenever we are having conversations, we will be calling upon you. Now, in terms of the roadmap to formation of a consensus document, I'm going to invite Lenny to talk about this. She has been a guru in formation of such consensus documents. So she will take us through what we need. And then, of course, she's going to give us a summary of the key insights and a takeaway from this symposium. And after that, she will invite our head of department to close this symposium. Thank you very much.
Thank you all very much. I think Halima has already mentioned the outcomes or the outputs of this stakeholder engagement. And we are very, very interested in forwarding these conversations. We hope that these conversations will not stop in this room. We hope they are not left in the abstract and they are not as academic as some of the conversations have been. That's not to say that we've not had practical engagements. We thank you for the live examples. We thank you for sharing best practices. And I will move directly to what we think this consensus document will entail. Just for a bit of context, Afya na Haki has already formed an alliance on reproductive justice, which focuses on sexual reproductive health and rights. And we have we had a consensus document where we had partners in the room just like this. They identified the problems in our continent on that subject of sexual reproductive health and rights. And they deliberated on the opportunities that exist and solutions through which we can tackle those problems and challenges that were identified in that room. Now, that is really what the consensus document will have, but it's just a form of agreement that we pledge to take forward work and the discussions that we've had in this room, and some of the ways have already been explained by my colleague Alima. So this is just listening to the discussions in the room and the panel. These are a few keywords that we were able to get from the discussion. I am sure if you read one or two words, they can trigger thoughts on some points that were made by NITA, by the allied professionals body, in the medical professionals body, by the lawyers, by the community practitioners. And these words have signify the problem. Some of them signify the gaps. Some of them signify the solutions. And I don't know if we should delve into them deeply, but I'm sure they trigger some thought. So we'll be able to put together these words and frame the problems and the solutions into a consensus document, which we shall share with you on the platforms that we would have formed. And we will seek your indulgence to review, to help us note whether there are things that we've left out or there are things that need to be taken out. So allow me to talk about briefly the weaknesses that we realize exist in this domain of digital health. And this was collected from most of what the panelists spoke about, but also the discussions in the room. What stood out was the fact that we have legal and policy frameworks, but they are not grounded properly in human rights. So we need to have a human rights-based approach in order to tackle the issue of inclusion in digital health. The efforts are fragmented and people are acting in a way, in silos. So we hope that work done in this space should be synergistic in a way, so that we don't duplicate efforts, but rather maximize the gains that we have achieved so far and be able to sustain those as well. Issues of community engagement came out so strongly. Many people were speaking about how certain groups are being left out, and why we are in this room, technocrats are engaging in these discussions and leaving communities out. So community engagement is paramount, because ultimately deployment and adoption and even legitimacy of digital health tools and other attendant mechanisms are dependent on communities. Then there were issues of political will. There were comments on priority. What does government prioritize? There were comments on progressive realization. So political will is also something that came out strongly as a weakness, but also as something that we can leverage on to gain better results. I could go on and on and on and on, but since our time is really fast spent, I would like to move on to the way forward, which I assume you've already deduced from the weaknesses that I have highlighted. So one of the things that we need to do is to co-create with the communities, even when we are developing these apps, even when we are taking on policy discussions. Communities should be at the center. They should be able to articulate their needs, and everything that we do should be able to address the needs of the community, so that we don't operate in the abstract, but we contextualize our interventions. The issue of governance and accountability, both at the regulatory stage, at the individual stage, but also civil society plays a key role to check and ensure that there are balances. Our keynote speaker spoke about public-private partnerships. How can we leverage this? We know that historically, sometimes PPPs have power imbalances, because most times in Africa or in Uganda, we have multinational corporations that are way stronger than the states that enter into such agreements. So how can lawyers, in designing these contracts, how do they have the interests of the communities at heart to ensure that, someone doesn't just import practices from wherever they come from and make them fit into the Ugandan context when they don't actually fit. Ms. Zalwango spoke about the need for evidence. We cannot understand the depth of the problem that we have unless we go on and research and find evidence to support either advocacy initiatives, but also to support the creation of solutions to the challenges that would have been identified. There were issues of infrastructure, internet connectivity. We cannot speak about digital health if we don't have the necessary infrastructure, but also capacities to even deal with this infrastructure is also important. So the health workforce also came out strongly. We need to be able to capacitate them to handle this data, but also help ensure that they consider the ethical issues, which I think one of our colleagues at the panel spoke about in terms of disciplinary action for people that breach patient rights, things to do with consent, confidentiality. So as you can see, it needs to be a synergistic approach where we collaborate. And so these issues will all be in the consensus document. So we pledge to share a draft, which we beseech you to contribute to. And probably we can collectively own that and take this work forward. I guess that's it from me, Alima. I will hand over back to Alima and she will take us through the next sessions. Thank you very much for coming.
Thank you very much, Lenny. There are no any more sessions. We are going to close. But before we close, Lenny, I would like you to support me. I just want us to use only 2 minutes before I call the person that is coming to close. Everybody in this room is just going to say only one word. Please don't say 2 words, only one word to describe this session and what we have been doing. So I'll start with Caroline. You give us only one word to give us a summary of what has happened here today.
Integrity.
Thank you.
Informative.
Analytical.
Interactive.
Enlightening.
Awareness.
Insightful.
Passing the mic. You say encouraging.
Engaging.
Inclusion.
Educative.
Diversification.
Eye-opening.
Worth it.
Encouraging. So thank you. It was perfect.
Awesome.
Can I use Luganda? No, I don't know Lugandas. Incredible.
So thank you very much for giving us these words that are summarizing what we have been doing. And when we bring up this interactive forum, you will be seeing these words pop up once in a while. So without wasting time, I'm going to call the country representative of Boabab Sako. He's a digital expert. He has been a digital expert for, I think, now 9 years. And this is Mr. Elijah Mukwaya. He's going to give us the closing remarks. And then after that, we should be able to go for our lunch on Renzori Terrace app. So, oh, sorry, Ibrahim. can you stay behind? We are going to have a group photo before lunch, because normally when we eat, something happens. So we don't want to destroy. Would like to have you with us during. Okay. Fatina, you will guide us on where we are taking the group photo right here. Okay, so we will have Mr. Elijah close. We have a group photo, and then we go up. We have a terrace where we are going to have our lunch. So, Mr. Mkwaya, you are welcome.
Thank you so much. Good afternoon. I'm a bit shy, so bear with me. So I'm the names of Elijah Mkwaya. I've been in the digital space for 9 years. I've been in fintech, ride-hailing, mobility, logistics, and now I've joined the health sector. And this is my 4th month. Very interesting. I think for me, this session has taught me a lot, but I think my key taking would be collaboration as a sector. And why do I say this? Mr. Momuza said about a project that you're doing with the hospitals, and something we're also doing with UPMB, right? Similar, the same thing, but different fronts. I'm just managing if we had had question earlier on, right? I think by now we would have gone to maybe 40% in terms of delivery, right? Looking at inclusion, right? We know digitally, in terms of face-wise, is less, right? So what does that do for inclusion? So we do what we call telemedicine, e-doctor, pharmacy delivery. That means that gap is closed, right? So either I'm LGBT, whatever it is, right? I don't face that challenge. That means I'm able to get the service, 1, in real time, but 2, efficiency, right? Looking about mental health, I'm one of the people who have faced that thing, right? I had a mental breakdown a few years ago, but I was scared to actually go and meet someone, right? So I was able to use that, but not in Uganda. So I was able to do that from an app in South Africa, right? But now we have it locally. So as a user, that means it's efficient. And I think lastly is the key thing would be, are we user best? For every decision that we make, policy-wise, legally-wise, app development-wise, are we user-best? Because at the end of the day, we are serving the users, not ourselves, right? Whatever policy we're making is for the last person, the last mile. So whatever we come up with should go down to the user. Is it efficient to the user, right? If it's data privacy, is it protecting the user? If it's the service or offering, if it's mental, if it's general health, is it serving the user? So I think that would also be one of my key takings from these sessions. And I'm grateful that I've been part of this session. And I think from that, I will say have a good afternoon and enjoy your day.
Thank you very much, Elijah. You're actually not shy. So we didn't notice that. So can we move forward and take a group picture? And then we are good to go. Thank you, everyone, for honoring our invite. We are very grateful. And we hope you can always come along whenever we call you. Thank you.
Excuse me. We are implementing a project.